Hi, everyone. It's Dr. Azi here. Welcome to the More Than a Pretty Face podcast. I'm here to answer all your questions about skin, health, beauty, and wellness, and take you behind the scenes of my practice. If you have any questions you want me to answer, send me a DM on Instagram at Skin by Dr. Azi, and I'll be sure to answer them on the show. Now, let's get started. Welcome back, guys. I am here today with Nurse Lacie on a rainy Monday. How's it going?
Great. Sorry for trying to hold your hand there.
Oh, don't be sorry. We just did a Fox News segment this morning,
Yes,
so we have
so
been
fun.
up and ready to go. I'm so excited about today's episode because it's something that so many people suffer from, especially women, and it can be so devastating. And that is hair loss, whether it's genetics, hormones, stress, autoimmune. We are here to cover it all and give you insight from the perspective of a dermatologist who treats a lot of hair loss.
Yes.
I mean, I see so many women
So
every
many.
day in the office. And you know what I feel really bad about these women is that they go to, doctor's appointments or whatnot about this, and they're sort of brushed off and they're like, oh, you have a lot of hair, you're good. Like,
Yeah.
nobody really takes the time to look at their scalp and look at labs and all of this workup that we really need to do for hair loss. And they're devastated. Not only are they quietly struggling with this very,
Emotional and
very emotional.
critical.
Self-critical, yeah. It is something that really affects people's confidence. It affects so many aspects of their life. So I hope that this episode helps those who are struggling with hair loss and helps you find a solution so that you can regain confidence and live your best life.
Live your best life. And not just women, men too.
Men too, yes. But before we get started, guys, don't forget to rate, review, and subscribe. If you find this video helpful, share this with a friend because sharing is caring. And check out our Instagram at More Than a Pretty Face Podcast. So, you have a beauty and blemish?
I have a great beauty and blemish. I've been holding secret just for you.
Oh, I love it. I can't wait to hear about it. Okay.
Okay.
Share away.
So it's a 2-for-1.
2 for
Okay. And the beauty is I went to my first Persian wedding.
You did.
Yes. It was
I love white people at Persian weddings. They're like, whoa, you guys are so over the top.
I mean, but so beautifully over the top. It was amazing.
Yeah.
It was at Hotel Del.
Oh,
and
very nice.
on the lawn. It was just breathtaking. And my blemish is I had my favorite heels on. Okay. And we are just getting there. We're entering the lawn and my high heel broke.
Like the
My
heel broke
heel
off?
snapped off of my shoe.
No, I'm
It was so embarrassing.
sorry. That's terrible.
I love these shoes, but I had them for a very long time. They were my tried and true. You have your favorite heels, and they completely gave out on me, and it was so embarrassing. And so I'm like, what am I gonna do?
Yeah. Well, you are a little Miss MacGyver. So what
am I
did you
gonna
do?
I just had to buy. I found one shop at Hotel Coronado that had heels in my size.
Oh my goodness.
And they were just not the
same.
cutest, just a small kitten heel and outrageously priced.
Oh, I'm sure.
I spent over $100 for these shoes,
Oh,
and I'm
no.
like, but we had so much fun. It was a beautiful wedding.
Oh. Well, I can sympathize with you because I had these boots that I absolutely love that I've had them for like over 15 years.
Yeah.
They're like these Gucci boots that are brown, and I wore them for a presentation at a conference like last year or the year before. And right before I go up to give my talk, the heel just disintegrates. Like it falls off. The bottom of the shoe falls off.
So embarrassing.
And I'm like, what am I going to do? Everyone's going to watch me get up on stage to give this presentation and my heel is going to be gone. Thank God there was a podium and I could hide behind the podium. But I literally had to just go on my tiptoes for that one boot. But to this day, I want to get them fixed and I can't get them fixed anywhere because they're so old.
I didn't even tell you. The guys behind me picked up my heel. They're like, ma'am.
You dropped your heel.
I was mortified. I'm like, and I'm white, walking into this beautiful Persian wedding and my heel falls off. This is
Oh no. Well, was your dress long? Because at least no. Okay.
Nope. I'm like, I'm probably going viral somewhere on TikTok.
Look at this poor girl at a Persian wedding, lost her heel.
Oh my goodness. But yeah, so I knew you'd love that.
I do love that. And I can sympathize. I had a very similar story.
And how about you? Any beauty or blemish for this week?
Well, I think I've told you maybe that I went to Coachella.
Yes.
With my daughter.
Yes.
And that was an experience. That was like a beauty and a blemish on its own because I had no idea what I was getting myself into. First of all, everyone is like 20 years younger than me.
Right. Yeah.
And in a way different mental status than I am because I'm just trying to survive with two teenagers and my friend and I took our two teenagers. But, it was, it was overwhelming. It was hard. You had to walk a lot. I was constantly worried and so whatnot. But it was a great experience because you're out in the middle of the desert. You're listening to music and you get to experience it all with your daughter, who is like my best friend. I love her to death. Like I'm going to be so sad the day that I can't go to Coachella with her or I can't go on trips with her and so forth because she's going to want to go on and want to be with her friends and not me anymore. So I'm just trying to savor every last moment. So it was very special.
Yeah, for somebody that would never go to Coachella.
And I think we have a clip of me saying this very same statement. Well, to me, Coachella does not sound like an easy trip. I mean, talk about braving the heat, the sun. I know it's popular. I've never been, but it's never been one of those things where I'm like, I really want to go to Coachella.
Yeah.
Because I just think of my skin in that poor weather.
I'm not surprised.
But I don't think anybody. But what I do for my teenage daughter, I guess.
And now you understand.
I had to suffer at Coachella.
You survived. I survived Coachella.
Yeah. It wasn't true suffering. I mean, I think it's really good for us humans to challenge ourselves, to go and do things that you normally wouldn't do. And so I think it's part of my anti-aging and wellness journey to do that. So, yeah.
Good.
So let's get into it. Hair loss.
Okay.
We hear you. I get so many questions on this. So I thought we'd dedicate an entire episode to it.
Let's start with the most common type of hair loss you see in the office.
So that would be like male pattern baldness, and the equivalent in females is called female pattern hair loss. And essentially what happens is when you're born, your follicles are genetically predetermined, if you will. The destiny, the faith of your hair follicles is that over time, at some point in your life, what's going to happen is the follicles are going to start to miniaturize and shrink. They're going to get smaller and smaller and smaller. And then eventually those follicles will go away. And it's the same phenomenon in women and men. Unlike men, women actually never go bald, but they can go really thin, particularly on the top of the scalp and the sides. And so this can happen. I've seen it as early as in the teenage years, unfortunately, but typically it happens around, the fourth or fifth decade of life. So later on, particularly, time of menopause, we see this a lot. And so oftentimes I also see like telogen effluvium, which is another type of common hair loss. This is when you get all of a sudden you get, shedding of hair, and that can trigger female pattern hair loss or male pattern baldness. But telogen effluvium is a completely different type of hair loss.
What is the difference?
So telogen effluvium is typically when there's an insult to your body, your health system. So that could be, for example, a common one is childbirth. So when people give birth, you've probably heard of women losing their hair 3 to 6 months later, but you generally recover from that for most people. But there is that, population of people that type of hair loss can actually trigger the female pattern hair loss. And so that could be a surgery. It could be something like general anesthesia. Maybe you get really sick with the flu and you have fevers.
So the insult or, injury isn't specifically in the hairline or scalp.
Yeah, it's just a stress on your body or your mind. So let's say you're undergoing, life changes, a divorce, a death, where you have severe mental stress, or you get really sick and you have you go through some stress on your body, and then your body says, well, hair is important, but it's not as important as the liver or as the gut, or and so these other organs are way more important. So I'm going to dedicate all my resources and energy to these organs and let the hair suffer. And in that case, what happens is you just get shedding. All of a sudden, your hairs that are in the growing cycle enter into the resting cycle, and that's when they all fall out. And so that's why I see it like 3 to 6 months down the line, because it takes some time for the hairs to transition.
Interesting. So you won't see it immediately in that stress that you're experiencing necessarily, but maybe 3 months later.
Yes.
Okay.
3 to 6 months. And now in the time of Ozempic and these diets that are extreme, all of a sudden you're losing all this weight where your body may not getting enough protein, or your vitamin deficiency might be low. We see a lot of, for example, vitamin D levels that go below a certain threshold. That's stress on your body. I don't think we realize little things like this can be stressful on your body. And again, it comes down to genetics, because some people, they can just power through this and, they may have some shedding, but then they'll recover. There are others, unfortunately, that don't. And that's when we see this female pattern hair loss kick in, and it's a chronic process. It's essentially the miniaturization starts to happen and you lose those follicles, and that's just the destiny of your hair follicles.
That's unfortunate. What are some ways to test to know if you're going through that, or to really confirm, I guess, that you're going through it? Well,
it's really important to see a board-certified dermatologist, because we do specialize in not only skin, but also hair and nails. And oftentimes we'll evaluate the scalp and make sure that that is, what's happening, because there's different patterns we look for with telogen effluvium, with female pattern hair loss or male pattern baldness. And then we may do what's called a hair pull test. And that's when we, tug at a few hairs and kind of get an idea of whether a lot of your hairs have entered this resting or falling out cycle. Because generally 90% of hair follicles should be in the anagen phase, and that's the growing cycle phase. And if we're noticing, more hairs in the telogen phase, and that's the resting or the falling out phase, then we know that there's, something going on. We also look at the ends of the hair with a special light. Sometimes we'll do hair biopsies, but generally not for this type of hair loss. We also do labs. I think it's really, really important to make sure your vitamins, your hormones, all of those things are kind of up where they need to be. Now, you say hormones, but really hormones can't really be measured per se, unless, for example, your estradiol is like less than 1. It's like almost like undetectable. Right. For example, if you're in perimenopause or menopause, then it's helpful. But hormones, because they fluctuate so much all throughout the day based on the cycle, it can be a little bit tricky. Now, the things that we do measure, though, are vitamin D, because I've seen so much hair loss related to low vitamin D levels. Sometimes the vitamin D is normal, but it's on the lower end. So you want it to be, kind of mid or on the upper end. Okay. And then we also look at iron and TIBC. So if you're watching this or listening to this, get out your pen and paper. Make sure when you go to the doctor, they check all of these. And then TSH, so that is a hormone.
Yeah,
I think
your
that's what you were
thyroid, right?
referring to. So your thyroid is huge. And if there's any sort of imbalance in that, hair loss is a big one. We also look at ferritin, which is an iron protein that oftentimes is low, but it's not optimal.
Okay.
So a lot of doctors will say, oh, your ferritin's fine, your iron's good. It's an iron protein. But for hair loss, we want it to be above 65.
Okay.
Because if it's less than 65, even though it's normal less than 65, we still want it to be at an optimal level, because we want your hair follicles to be treated really well and we want to support them in their growth. So those are the things. And then, we can do DHEA and estradiol if it's some, crazy value or number. And, sometimes testosterone, especially if you're like perimenopausal. So those are kind of the core labs. But I also always counsel people on, are you getting enough protein? Because now with all these different diets, you never know. People might be going vegan or, losing all this weight all of a sudden. That's a lot of stress on your body.
Interesting. Those are all things that you don't normally think of as just a person on the other end going through that.
Right.
What are some treatment options?
Well, I always say that, there's supportive treatments, and then there is, treatments that actually stimulate hair growth. So supportive treatments would be things like vitamins. You can take Viviscal. I'm actually taking that now because I'm looking into this vitamin.
What is it? It's a vitamin?
It's a vitamin for hair. So all the essential things that we talked about, like, having vitamin D, biotin, all these vitamins that are important for hair, that if they're low, your body's going to say, okay, I'm going to divert the energy. Hair is the first to go. So you do want to make sure that you're giving your body all the support and reassurance, if you will, that it needs. So vitamins are helpful, things like Keratin or Nutrafol, Viviscal. These are very popular brands that are helpful. And then you also want to make sure that eating a well-balanced diet. And then there are the stimulating, the medications or the therapies that actually can help stimulate and reverse that shrinkage process. Because remember, the hairs get smaller and smaller and smaller. Eventually they go away. You want to catch them early, guys.
Before
if there's one thing I can tell you about treatment, start early, ASAP, because you do not have time to wait it out, to figure it out. Just start treatment, because if you lose those hair follicles, they're gone forever. I mean, you're only born with so many hair follicles. So you want to catch them in that miniaturization stage so that you can reverse the process and salvage as many hair follicles as possible. So especially if you're younger, even if you're, in your 20s, start treatment. One that's been shown to be the most effective and 100% stimulates hair follicles is minoxidil.
Minoxidil.
Yes, which has been this miracle drug, a very inexpensive, very low dose. I mean, they've done studies. So traditionally it was a blood pressure medicine, right? And they noticed, wow, these people that are on this blood pressure medicine are growing a lot of hair. I mean, but the dose for blood pressure is usually like 5 milligrams, 10 milligrams. For hair, you only need 1 milligram or even half a milligram in women and 2.5 milligrams in men. And that's just such a baby dose. It really doesn't affect your blood pressure. And long term, it's been shown to be pretty effective. Now, that's the oral version. You can also do the topical.
Can you do them together?
You can, but studies have shown actually the topical and the oral version are showing very similar effects. So you can do one or the other, or if you really want to, salvage those follicles, you can take both together, the topical and the oral.
I feel like the topical is so controversial. Like, you have the Rogaine over the counter for men, and then you have one for women, but realistically...
And I have a problem with that.
I know.
Because actually, the Rogaine for women is more expensive.
Yeah.
Can you guys believe that? It's 2% minoxidil. The men is 5% minoxidil. So I tell women, use the men's formula.
Right.
It's perfectly fine. The 2% I don't think works very well. Now, you may want to use the 2% on your eyebrows, which is what I do for my eyebrows. But... the 5% for men is fine. It says, and on the box it says, do not use if you're a woman. But that's just BS. And that's because nobody, dished out
Studied,
millions
right?
and millions of dollars to do studies, so they can't put that on the label. But guys, it's perfectly fine for women to use 5%. We actually have a prescription in the office that works so well. It's
So good.
7% minoxidil along with finasteride. And that combination grows so much hair. We see these people back at 6 months. We're like, whoa, look at you with that mane. So it works really, really well. Now, finasteride, as I mentioned, is a DHT blocker. And typically it's used in men.
For those watching, what is DHT blocker?
So what happens then is the DHT makes a conversion in the hair follicle that it has to do with the hormonal pathway that then causes or starts that miniaturization process. So really it targets that miniaturization process and reverses it. And there's also Dutasteride, which is a newer DHT blocker, and that's actually more potent. It's been shown to be a little bit more powerful than the finasteride. Now, caution, if you are a woman and you're taking these, you cannot get pregnant.
No.
You will feminize your fetus, which means that if you have a male, it's going to block any sort of male organ development. So this one thing, you don't even want to touch these medications if you're pregnant, meaning like physically come into contact with them. And for minoxidil, we do want to say about pets.
Yes.
It can be very toxic to cats. Is it cats?
Yes. Well, it can be dogs too.
Dogs too,
it's found more so in cats.
So don't feed it to your cats and dogs. Be cautious. They don't get into that bottle.
And you just wash your hands really well after applying and just be cautious.
Yeah, be cautious. And it's fine. You can go to bed and sleep with your pet. It's fine. Unless you put it on and then you put your head in front of the dog and have them lick it, you're fine. Just don't do that and you'll be fine.
Yes. My dog survived. Yes. I mean, he was fine.
So those are the main, forms of treatment. Now, there's also PRP that we do a lot of in the office. And what that does is it helps extend the anagen phase of hair follicles. Because especially with female pattern hair loss or just with aging, the anagen phase, which is the growing phase, starts to become shorter and shorter. So then the hairs aren't growing as long as they used to, or they're not staying in the growing cycle as long. So PRP is it can be therapeutic, but it's also very supportive of hair growth. So if you're trying to kind of recruit all these dying hair follicles into the growing phase, then I would do medical therapy, which we just talked about, along with PRP. And we also actually do dutasteride injections in the office,
I was going to say that.
which has really worked very well for people who don't want to take it orally, because a lot of times people just don't want to take something that has an internal or systemic effect. They just want it to go to the hair follicle or just be applied topically. And because dutasteride has such a long half-life, then we do a treatment, and then a month later we do another injection, and then you just do it once every 3 months, and it works really well.
Patients
so you're coming in like 4 times a year for these dutasteride injections, and I think in the future we're going to see that being developed almost like a solution with other things like other growth factors or other treatments for hair loss. Another therapy is spironolactone, which we love in dermatology. It's also another older medication. It's a diuretic. It's a water pill. And it works great for acne. It works great for hair loss. And it's really for women, because if men take it, it can actually make breasts bigger.
They don't want that.
They don't want gynecomastia, which is when your breasts develop or you form breasts. So in women, though, it's a very welcome side effect, because it can make a
magic pill.
Breasts,
your hair
cup
longer,
size,
your skin clear.
So it does help with
boobs.
stimulating hair growth on the scalp, reducing hair on the face, helping with acne. It's really kind of like a miracle drug. But in my experience, you have to be on pretty high doses to have that effect. Again, it's an androgen blocker, and that's how it works, is because androgens are the hormones that cause this miniaturization process and lead to the hair loss in females and males. And so it's another option. It's really important to talk to your doctor. These are all just for educational purposes and determine what's right for you, because everybody's different. You know, some people are like, well, if you give me a topical solution, I am not going to apply it.
Right.
So if you're not going to apply it, it's not going to work. So you may want to do an oral. Maybe you don't want to do an oral because you are worried about the side effects. So all these things are factors. So it's really important to have an evaluation, figure out what type of hair loss you have, and have that discussion of what's the right treatment for me specifically, and not just, you know, your friend or whatnot.
Yes. So we've talked a lot about the hair phases and cycles. What exactly is that? Like, how long do those phases last?
Yeah, great question. So there's really 3 phases. There's the anagen phase, which is the growing phase, and that's when follicles are in that state. That's when they're growing. And then there's the catagen, which is the transitional phase, when they transition from anagen to telogen. That's the 3rd phase, and that's the resting phase, the phase that the hair follicles fall out and remain in that area. And they cycle every 3 months or so on the scalp. Now on the face, it might be like 6 weeks. So depending on the hair and where it's located on the body, they'll stay in these different phases for various times. But for the scalp, it's about 3 months.
Okay. And probably good for the viewers to know that every hair follicle goes through their own phase, right? Not every follicle on your head is in the same phase at the same time.
Right. So, you know, that's why you can lose actually up to 100, 150 hairs a day, and that's normal because, again, all these hairs are cycling all the time. So when people say, I'm taking this, you know, this vitamin and my hair grew and it's been like 2 weeks. I'm like, well, that's virtually impossible because it really takes at least 3 months, if not 6 months, to really see an effect.
Yes.
Because that's just science. I mean,
Yes.
the hair follicles cycle every 3 months on the scalp at least. And so it is going to take about that long to see results on the scalp.
I was going to say patients do ask often and they give up quickly when they don't see results in just a couple of days, even a couple of weeks, even a month.
Yes. And you know what? A lot of people start these treatments and then they have this shedding. It's temporary, but they may shed for like 2 weeks because what happens is stimulating all these hairs that have been lying dormant. It's stimulating to enter into the growing phase. So it has to make room.
Yes.
And so you might notice a little bit of shedding, you know, accelerates the shedding of the hair so that it makes room for all these new hairs that are going to be entering into the growing cycle. So don't be alarmed by that. That's usually temporary. So I also want to say it is so important because this is artificial stimulation. Your hair follicles are destined to be gone. And so we are in 2025 stimulating them, keeping them alive with minoxidil, you know, dutasteride, all these therapies. And so if you're not consistent and you're not, you know, applying or taking your medication every day, it's not going to work. You know, you have to be very, very consistent, very compliant to see the hair stimulation. And people say, well, then you have to use it forever. I'm
Forever.
like, yes. Just like you have to brush your teeth forever, brush your hair forever, take a shower, you know, all these things that we do to maintain our overall health. It's just another one to add to the list.
Add it to your regimen.
I tell people, put it next to your toothbrush. You know you're going to brush your teeth twice a day. You can apply your Rogaine twice a day. You can take your minoxidil or whatever your medical therapy is.
Yes.
You know, daily, but you have to be consistent. If you ever stop, let's say you're like, oh, I'm not going to do it for this week.
My hair looks great.
Yeah,
I'm just going
I'm
to
gonna
stop.
Guess what? Like, it's so instant. Within 2
So
weeks,
instant.
I'm telling you, all the effects wear off. So all the hair that the medical therapy kept from falling out and all the hair that it helped regrow, boom, vanished. So it's really important to be consistent with your medical therapy when it comes to hair growth, because remember, guys, we are artificially stimulating that hair.
Yes.
And so if you're not consistent, it's not going to be very effective.
Yeah, I know. I feel like patients get so discouraged when they start it and they see that little bit of hair loss. They think that the medications caused their hair loss to worsen. And then, you know, as soon as they stop it because they think everything looks good, then it's another panic attack of losing everything. It's hard.
It's rough, but you know, I'm hoping that this episode will give you enough of the science and understanding to know why the therapies are what they are and how they're going to work, so you have a better understanding and expectation of the treatments and how to navigate through it, because it is really stressful, and we have to be patient in a world that, in a world of instant instant gratification. Why don't I have more hair like tomorrow?
Yes.
No, it doesn't work like that. And really, the longer you use it, the better and better, because it gives the medication time to salvage more and more hair. So don't get discouraged if you're going through this and you're scared, unsure, devastated, all those emotions. There is hope. I tell people hair is regenerative, which is so important to understand. We can regenerate, we can bring them back, we can, help you with some of these treatments.
Trust the process.
Trust the process.
I hear there's some exciting research going on right now.
Yes. One recently, actually, this year, out of UCLA for a compound called PP405.
Okay, talk nerdy to us.
It's a small molecule that is going to wake up your dormant hair follicles. So even if you're bald, they're claiming, because it helps activate the stem cells of the hairs. And so even if the hair follicles are gone, remember I was telling you they miniaturize and they're gone forever. Well, it's 2025 and UCLA has done some really cool animal studies that is showing promise that even if they're gone, that we may be able to bring them back. So there is some hope on the horizon. I was just reading that the other day.
I love that.
There is some other things, like there's a plant extract topical that is in early phases for hair loss, but nothing quite yet. The ones that we talked about earlier are the staples. It's what is hot and effective right now.
So what do you think about some rapid fire questions?
I love it. We haven't done that in a while.
I know.
But before we jump into the rapid fire questions, we have something very special for our podcast listeners, because you guys are so loyal and we love you so much that I want to give you guys a 15% off at AziMD Skincare, which is the science-backed skincare we always talk about that shows real results, real changes in the skin. So for podcast listeners only, you can go and use the promo code POD15 at AziMDskincare.com. That's AZIMD skincare.com, and I'll link that below.
Oh my gosh, I totally forgot about alopecia areata.
Oh yes.
We didn't talk about that at all.
It's not as common as the female pattern hair loss or the male pattern baldness, but some people just refer to it as alopecia, but I don't think people realize that alopecia just means hair loss. Alopecia areata is a specific type of hair loss. That's an autoimmune hair loss.
Yes.
And it usually presents most commonly with patches of hair loss. So you might wake up one day and notice, oh my God, I have a bald spot, but it's this round spot. It's not like your whole hair.
Right.
And it's an autoimmune phenomenon. No, you don't have autoimmune disease like all over. It's very specific for hair. The hair follicles are there. They just can't grow because your body is attacking the hair follicles. Your body, meaning your white blood cells, are attacking the hair follicles, and we see it under the microscope. It looks like a beehive. The follicles getting attacked by like a gazillion bees, and it doesn't allow the hair to grow. And it can be quite devastating because all of a sudden
it's scary. It's like, it almost like, for somebody that's not in the medical field, it almost looks like little like scar patches.
Yeah, because the skin's smooth and there's no hair there.
Yes. Yeah, it's scary. It's alarming to wake up to that.
And it can be severe, and it could just be like little patches on the scalp, but it can also involve the entire scalp. It can affect body hair, facial hair, like your eyebrows, your eyelashes, your beard, your body hair, although women probably glad to get rid of the body hair. But yeah, it could be really very sudden. And the most effective treatment, if you just have the patches, for example, is giving you injections in the office. So we use Kenalog, which is an anti-inflammatory. It helps calm down those white blood cells that are attacking the hair follicles. And so it helps allow them to grow. And typically after 1 or 2 sessions, we do see hair growth back. So it's very effective. We can also do other things like DCNP, which is where we cause a little bit of irritation away from the site to distract your white blood cells from the hair follicle and move to the new site for inflammation. So we kind of trick your white blood cells. And then there's some new therapies, JAK inhibitors. These are immune modulators that can help, particularly with the more advanced stages, like if you're having, the full scalp is being lost, or if you have your eyebrows, your eyelashes, you have a lot more involvement. But generally for the milder cases where it's just patches, the injections work very well.
Okay, are you ready for the rapid fire questions?
Ready.
Ooh, I'm so excited. Okay, so if you have dandruff, what should you not use?
Don't use oils. I see so many people, they're like, my scalp is dry, it's flaking. And so they'll use oils.
Yeah,
I'm like, that's the worst thing you can do. Because
Okay.
dandruff is caused by buildup of oil and yeast. The yeast feed on the oils, they break it down, and then your skin has a reaction to that. And the flaking that you see is not dry skin, it's irritated skin, so it's flaking. So you're just putting oil on, you're just feeding the yeast. I always laugh at that. So,
Okay, what should you use for dandruff?
very good. Yeah, so, it actually is helpful if you wash it every day, particularly with like a medicated shampoo, something with zinc pyrithione or even salicylic acid. I actually really love the one spray because it has glycolic acid and salicylic acid.
It's a spray.
And it's a spray. And I love that it dries quickly. And so it works really well for hair bearing areas, and it reduces the yeast. It helps regulate oil production and works really well for dandruff and also just scalp psoriasis. If you have buildup of scalp on your scalp, then the one spray works really well. It's super convenient. So
air dry or blow dry your hair?
Blow dry. A lot of people think, actually had this discussion the other day, a lot of people think I'm gonna treat my hair really well. I'm not gonna blow dry it. I'm just gonna let it air dry. And if you have a lot of hair and it's long, that's probably the worst thing you can do for your hair. I know it sounds counterintuitive, but you do want to dry it actually with like low heat protector, because hair is at its weakest point when it's wet. And so the longer you keep the hairs in the wet, damp state, the more likely you are to get hair breakage. And you can also get frizzy, that's why you see so much more frizz with your hair when it's being air dried. And so actually dry it with low heat. It's much better.
Okay. Does daily hair washing make hair fall out?
No, that is a myth. I know people are like, I don't want to wash my hair because it's going to fall out. But you're just going to hold on to all those hairs that are already in the falling out phase, and they're all going to come out in the shower. So if you wash your hair only once a week, you are going to see more hair come out than if you wash it every day, because if you wash it every day, you get a little bit that comes out every day. But if you save it all for the shower, then you're going to see all of that come out. But if a hair is going to fall out, it's going to fall out. And you could be sleeping, you could be walking down the street, you could be taking a shower, you could be brushing your hair. If it's in the telogen phase, in the falling out phase, it's going to fall out. So if you do have dandruff, washing your hair every day is actually good because you're washing off the oil, the yeast, and so it's actually better for you.
All right, last question. Is collagen powder legit for hair?
It's not going to hurt you. It is a source of protein, so I think it's helpful. Supportive. I would say supportive, especially if you're not getting enough protein in your diet. Then it can be helpful.
But not your main source.
Yeah, it's not like medical therapy. Again, hair loss is a medical condition. There are great treatments right now that really truly work. So you don't want to, hold off on that and just rely on, collagen powders or vitamins.
Yeah.
It's something that, you should get a medical evaluation by a dermatologist and get treatment if you need it.
Yeah. Thank you so much for that breakdown.
Yeah, that was so fun. If you guys have any questions, leave them in the comments. Don't forget to rate, review, and subscribe. Share this with a friend who may also find this information valuable. Until next time, bye guys.